Hi, I'm Hunter Kadra,
I'm Charlene Meserve.
And I'm Hannah Brown.
and we did our public service announcement on substance abuse. Substance abuse is an overindulgence or dependence on an addictive substance, especially drugs or alcohol. Our PSA is to limit substance abuse to help protect the health, safety, and overall quality of life of human beings. There are several drugs that can be abused, but we've chosen opioids and alcohol to focus on for our PSA. The dangers of substance abuse. Alcohol. People do not always have a good grasp of how much alcohol is too much for them. Alcohol in moderation is okay, but drinking in excess can cause a majority of problems and consequences in your life. Here are some of the consequences that could happen from drinking too much. Damage to the heart could include arrhythmias, strokes, and/or high blood pressure. Drinking can also affect the liver and cause liver inflammations and cause alcoholic hepatitis, fibrosis, or cirrhosis. Drinking too much can cause cancer, issues to the pancreas, and also issues to the immune system. Opioids. Pain relievers provide a sense of euphoria as well as pain relief. They can sometimes be misused, which will lead to dependence, overdose, and/or death.
This picture shows the negative effects of substance abuse on your body. It includes systemic, circulatory, heart, eyes, mouth, skin, respiratory, and muscular.
Statistics. 53.3% of high schoolers reported never using illicit drugs in 2009. 40% of adolescents ages 12 to 17 reported that they perceived great risk associated with consuming 5 or more alcoholic beverages on a single occasion once or twice a week in 2008. In 2006, there were 255,374 admissions to Level 1 and Level 2 trauma centers to substance abuse treatment programs for injecting drug use. 9.9% of persons aged 12 years and over who needed alcohol treatment and/or illicit drug treatment reported that they received specialty treatment for abuse or dependence in the past year in 2008. 23.5 million people ages 12 or older reported that they needed treatment for an illicit drug or alcohol abuse program in 2009. There were 1.8 million admissions in 2008 for treatment of drug and alcohol abuse to facilities that report to state administrative data systems. Around 41.4% of treatment admissions involved drug abuse, and heroin and other opioids accounted for the largest percentage of drug-related admissions, which was around 20%, followed by marijuana, which was 17%. The age range with the highest portion of treatment admissions was 25 to 29 group, which was 14.8%, followed by those 20 to 24, which was 14.4%, and those 40 to 44 at 12.6%.
This is an image showing more statistics on drug and alcohol abuse. 1 in every 12 adults is affected by alcohol abuse or dependence. Approximately 1 in 12 women and 1 in 5 men develop alcohol dependence in their lifetime. Alcohol is the primary drug of abuse in Texas, and in 2014, 51% of students in grades 7 through 12 reported having used alcohol.
Reasons why people abuse drugs and alcohol. There can be a number of reasons why people abuse substances, including alcohol and drugs. The two most influential reasons is biology and environment. Biology includes the genes that people are born with, and it can impact the people's risk of addiction. A person's gender, ethnicity, and mental disorders affect this. And a person's environment has different influences like family and friends and status in your general quality of life. Things like peer pressure, physical and sexual abuse, and early exposure to drugs and stress, and your parents' guidance can affect these. Prescribed medicines. People believe that when doctors give them medications, it is safe for them to take it. However, this is a common misconception. Fitting in and peer pressure. This is common among young adults. They want to use drugs and alcohol to fit in with their peers and other members. Legally, nicotine and alcohol are legal substances, so people don't always understand how addictive and abusive they can be. To feel good. Some people believe that alcohol and drugs will help uplift their mood and make them feel better. Self-medicating. Some people use drugs to help with side effects of medicine or to treat untreated illnesses. Gateway and experiencing. This is not uncommon for people to experience and try out different drugs. This can also lead to addiction. Availability. Drugs are available on the streets, prescriptions, and nicotine and alcohol are readily available to buy. Depression. Some people use drugs and alcohol because they are lonely. They believe that when they use these, it will help fill the void. Other examples of why people abuse drugs and alcohol: boredom, a way to deal with stress, growing up in a home where alcohol and drugs are commonly used by parents, relationship problems, loss of a loved one, financial stress, teenage rebellion, to promote relaxation, to forget their normal life, and for those who have low self-esteem.
If you or anybody you know has a substance abuse problem, there are several hotlines that you can call if you need help. The number is 1-800-662-HELP or online at pa.gov/opioids.
These are a few ways to avoid drug abuse.
Have positive self-esteem.
Get involved in activities.
Surround yourself with friends who do not abuse drugs.
Have defined goals.
Try to live a healthy lifestyle.
Surround yourself with loving and functional family members.